Hair Loss Treatment Show, Episode 8. Today we are talking about different FUE techniques. So now as we know that hair transplant has basically two techniques, strip surgery and FUE. Now FUE, which is the basically scientific name of that is follicular unit extraction. It has got multiple different names. So when patients plan to undergo hair transplant surgery, they get confused whether they should be doing one technique or another technique. The commonest questions that we face is, are you going to perform an FUE procedure on me, or are you going to perform, say for example, a DHI procedure or an ADHI procedure or some other names. So now this is what we are talking here. That is FUE and DHI or other names different procedures, or there are different versions of the same procedure. So friends, here the basic procedure is FUE, follicular unit extraction. The idea is that you are picking out hair follicles one by one. Now this technique has two main steps, extraction and implantation. And in these two main steps, you have multiple different ways of doing it. Extraction can be done either with manual punches, motorized punches, specialized motors, automated motors, different ways. In punches also you have multiple variations, large punches, small punches, fanned out punches, serrated punches, U punches, multiple different ways. In implantation also, you have different ways of doing it. Either you can do it with the help of needle, with the help of chisel blade, with the help of implanters, with the help of automated carousels. So, the same surgery can be performed with multiple different ways and multiple different combination of these ways. And what has happened of late is all these different techniques of doing extraction implantation, they have been given a different brand name by different companies or different people performing it. So does those different names really change what you are actually doing? No, it doesn't. Basically, you are performing an FUE procedure with some modification in extraction and implantation technique depending upon surgeon's preference. I may be performing FUE extraction in one way, in one particular patient, and maybe using another equipment in another particular patient depending upon the type of hair and type of skin that we are encountering. But that doesn't really change the name of the surgery. The surgery still is FUE. It's just that we have altered the surgical steps depending upon the type of hair that we are encountering. The same goes through with implantation. I may be choosing one equipment for implantation for one thickness and type and curl of hair, and will be comfortable with another implantation instrument in different type of patient. The technique is still FUE. So then, why are these different names? Say for example, DHI, that's one of the commonest questions asked. That are you performing DHI procedure or are you performing FUE procedure? So the full form of DHI here is direct hair implantation. Originally, the concept started from a doctor in Greece. The idea was that when FUE was designed, when FUE was innovated, the main limiting factor was time, because taking out individual hair follicle used to take lots of time. So then, lot of out-of-body time for the grafts, and then you start implanting them back in place. So that used to be a very lengthy procedure. And that used to give little less good graft survival as compared to strip surgery. So then this concept was designed in which you take out one graft, you implant it back at the same time. You take out another graft, implant it back again at the same time. So you are reducing the time of out-of-body time of the grafts overall. And that's how you are improving the graft survival. Initially, when we used to perform small sessions of hair transplant surgery, 300, 400, 500, that used to be the largest number of hair transplant when FUE was designed. DHI was still practically possible because you are performing small sessions and then you are able to manage the position of the patient accordingly, because extraction position is different, implantation position is different. But as the surgery evolved with larger number of grafts being performed, more or less taking out one graft and implanting it back in position versus taking out bunch of grafts and implanting back in position was giving you almost the same results, because the expertise and the instruments improved. So then the question arises was whether you really need a separate way of doing it, or doing it in general of taking out and putting it back is also going to give you the same quality of results. Friends, it depends a lot upon the person who is performing the procedure. But just by the name of the procedure, it doesn't give you assurance of better results as compared to other procedure. As we discussed, scientifically it's all FUE. The common analogy that I give to my patients is fever medicine. Scientifically, the name is paracetamol. Then you can call it as Dolo, Crocin, Metacin. So there are different brand names available. There might be some difference in salts along with paracetamol, but ultimately the content which is working is paracetamol. The same way in all different brand names, DHI, ADHI, safe, refusing, multiple different things. There is some minor modification in the technique, but scientifically it is FUE. So whether one particular technique is going to give you better result as compared to other technique, it's nothing there in the technique. Technique is same. The bottom line is FUE. What can be the changing factor in the result is the person performing the technique. So rather than getting confused about which FUE technique you should be going for, whether you should be going for FUE, DHI, ADHI, safe, refuse in multiple different power FUE, dense FUE, multiple different brand names. Basically, it's FUE. So all that you have to decide is, yes, you are going for a hair transplant surgery, in which you are going for a FUE hair transplant surgery, and then you just have to find out the person who is performing that procedure best. So is DHI better than FUE? Friends, they both are same. Basically, it's FUE given a different brand name. So the right question is not, is DHI better than FUE? The right question is where I should be undergoing my hair transplant. The technique is same. It's the person who is performing the technique which differs. So I hope this helped you to solve some of your questions about which FUE technique to select. And is DHI a better procedure or FUE a better procedure? They are all the same, with one being a scientific name and one being a different brand name. If you have any doubts or queries, please feel to write us on email or call us on phone. We'll be happy to solve your queries. See you in the next episode. Thank you.